Hello everyone, my name is Chanice Heath, and today in this video for Psychology 1010, I will be discussing marijuana and drug addiction. First, I will go over some background information about marijuana, such as facts and the origin of the marijuana. Next, I will talk about how marijuana helps cope with physical and mental illnesses. Lastly, I will discuss how marijuana differs from any other drug. The background behind marijuana. Cannabis, also known as marijuana amongst other names, is a psychoactive drug from the cannabis plant used for medical and recreational purposes. The primary psychoactive component of cannabis is tetrahydrocannabinol, one of the 483 known compounds in the plant, including at least 65 other cannabinoids. The cannabis plant, also known to scientists, originated in areas such as Central and Southeast Asia, where it was domesticatedly used for medicines. People from the land believed that the plant held some psychotropic nature. Discovered over 5,000 years ago, the marijuana cannabis plant was first prescribed for fatigue and malaria. Now, to more present times. From the 1920s, legalizing marijuana has been a fight between Congress in distinguishing whether or not marijuana should be used for medical purposes or not. Up until 1937, when William Woodward from the American Medical Association testified that marijuana has no evidence of being dangerous and further states several reasons as to how and why it can be used as a medical herb. The fight then continued up until around 2010, when it became legal to recreationally and medically use marijuana in the states. The cannabis marijuana plant has many purposes, which also helps with mental and physical illnesses. Which brings us to our next point: how marijuana helps physical and mental illnesses. Marijuana carries a lot of helpful substances, such as a compound called THC and CBD. THC and CBD, which are both psychoactive and non-psychoactive substances, are used by patients that are diagnosed with PTSD, anxiety, and depression. The THC compound helps with these. The CBD part of the plant, which is extracted from the plant in an oil-based substance, which can be administered to help with physical illnesses such as chronic pain, insomnia, and also helps with cancer chemotherapies to work to improve moods and help with nausea from the treatments of cancer. Parents around the world are looking for a safer medicine to help with their children's ailments without all the side effects that come with medicines that are usually prescribed for children. For example, in this video, the lady suggests that the use of the CBD oil helps with her son's seizures and physical cognitive abilities.
My goal for him is to hear his voice, to hear him talk. We just want him to be happy.
This is more than just make it so that he doesn't have seizures anymore. I want him back. I want him to thrive and live and enjoy us. And if a plant can do that, why do we object?
As you can tell from the video, she saw amazing results depending on the use of the CBD oil to help with her children's illnesses.
I had one child who started walking while they were using the medications.
We instantly saw results. He was smiling again. We noticed the decrease in seizures. He was able to transition. And at this point, he was finally able to gain cognitive skills.
How marijuana differs from any other drug. Marijuana is the only known herb-based drug. Grown and not chemically made, although have some pain relief feel from the CBD, it is not to be compared or confused to the opiates or other psychedelic type drugs. Marijuana also differs from other drugs not because it contains THC, which is the psychoactive part, and the non-psychoactive part, the CBD part. The two, however, can be separated for the desires of the individual needs of the patient. Marijuana doesn't hold any addictive properties, although a tolerance can develop. However, unlike the opiate epidemic, which last calculated to take up to hundreds of thousands of lives, also recorded to have 100 deaths per day, marijuana has no recorded deaths of any known overdose. In conclusion, not only does marijuana help those who are fighting mental illnesses, it also helps those around the world with chronic pain and helps those fighting for their lives with cancer. It also allows children around the world to become more active so they can enjoy better days without pain.